Hello, I am Dr. Karthik Rao. I am Additional Director, Urology, Uro-Oncology, Robotic Surgery at Fortis Hospitals, Bangalore. Today we have with us Dr. Mohan Keshavamurthy, Senior Director, Urology, Uro-Oncology, Renal Transplant and Robotic Surgery. We are here to discuss about robotic surgery. What are the advantages of robotic surgery when compared to conventional open or lap surgery in general?
It's a very interesting question. Basically, the robot has a higher magnification, a 3D visualization of the field of anatomy in which the surgery is being performed. It also filters tremors, especially useful to a surgeon, aging surgeon, wherein he has the experience and the ability but has also developed certain degree of tremors. One can sit down and operate, so basically as compared to laparoscopic surgery, you're not going to get tired. The straight stick effect of laparoscopy is obviated, is avoided, because the prehensile or 7 degrees of freedom of the robot has greater ability than the human hand. The human hand is limited in its rotation ability, but the robot has greater ability to rotate. And then there is this wonderful ability of the camera being controlled by the surgeon himself, unlike lab, where you need a cameraman or a person on the camera port who is as good as the surgeon or better. And the other important part is the fourth arm. You have an additional arm which you can switch. It is like having 2 right hands which are working alternately. So a combination of all this makes robotic surgery immensely superior to open or laparoscopic surgery. But that doesn't mean that robot has to be used everywhere. Where would I want to use the robot? Especially in the field of urology, the number one advantage of the robot is to preserve function. See, one of the biggest advantages of robotic surgery is in cancer prostate when you do robotic radical prostatectomy. The problem in robotic radical prostatectomy is that postoperatively incontinence and impotence, that is, the ability to control urine and the ability to perform as a man, if the gentleman still wishes to perform, is lost in more often than not in open or laparoscopic surgery, or it is not preserved completely. So preservation of continence and potency is far superior with the robot. So the first advantage of robotic surgery over conventional open or lap is preservation of function. The next thing is preservation of the organ. If you look at 20 years ago, there was a cancer in the kidney, we would knock off the kidney. If you look at a decade ago, we would knock off the tumor, but with 1 centimeter of normal tissue. As you know, the kidney is a male. That is, what we are born with is the amount of kidney nephrons or filters that we have. So the power of curing a kidney cancer in terms of quality of life beyond the cure is in the amount of function the kidney has, the amount of filters that you can preserve. So here you can take down the kidney tumor with 1 millimeter of margin so that you destroy very minimal normal nephrons or filters. So the second is preservation of organ. The third is when you are doing a kidney transplant, you want to work in a small area with great magnification. So compartmental surgery. So in these instances, even if it is a right-sided kidney with a very short vein or a complex anatomy, you can still do a very successful and a watertight anastomosis using the robot. The fourth is when the anatomy itself is challenging, for example, in pediatric patients, where the space is minimal, then again the robot is a huge boon. So overall, it is in preservation of function, preservation of organ, compartmental surgery, and in difficult anatomy. In all these instances, the robot plays a far superior or provides a far superior ability for excellent outcome.